So good evening, everyone. My name is Meetha Gupta. I'm a program manager, South India Zone for Pan India. And I'm very delighted to welcome you all to this important discussion forum. Today, we are going to speak about ultra-processed foods in human health. And today we will be, the topic today is, of course, of very much relevance because in recent years, we have seen that many people are shifting towards more convenience food in their daily lives. So before I start with this discussion, I would like to give some brief about PAN. PAN stands for Physicians Association for Nutrition, and it's a part of Global PAN International, headquartered in Germany. We are actually providing a medical network dedicated to equipping doctors, health professionals, communities, and institutions with rigorous evidence-based knowledge on healthy nutrition. Our mission in India aims to train at least 10% of the medical fraternity by 2025 to strengthen India's specific nutrition research and embed evidence-based nutrition intervention into the core of clinical practice and medical education. So our ability to transform the role of nutrition is focused upon our area of work, which is advancing research. We do observational researches and a lot of other researches to develop evidence-based guidelines. Our expertise also in policy advocacy, where we're engaging with government and policy makers for nutrition policy advocacy, education and awareness through CMEs and discussion forums like this. We collaborate with medical professionals and corporates for training and knowledge dissemination. And we also provide industry advisory. We support like-minded organizations through expert guidance and collaboration. So we are privileged today to have a panel of some eminent speakers and who will be discussing further about ultra-processed foods and their role in human health. So we have Dr. ANUJA, PETHE, Dr. VARSHA SHAH, Dr. Kiran Vaswani, Dr. Manali Pavan Rao, and Dr. Kiran Kulkarni, ultra-processed foods as well. Before. According to market data, we have seen there is a 40-fold increase in the sale of ultra-processed foods from 2006 to 2019, which is so much high. And this is often marketed for convenience, shelf life, taste, but they may also bring a lot of potential health risk. Ultra-processed food are referred to products that have been significantly transformed from the original whole forms. They are made through complex industrial processes and typically include ingredients like preservatives, sweeteners, emulsifiers, some taste enhancers, and artificial colors. So these foods are in ready-to-eat format. They're highly palatable and are inexpensive also, but are often seen to have high levels of like salt, high level of sugar, and some unhealthy fats in them. So the growing popularity of this food in country like India is due to convenience and of course the retail environment. They're readily sold. So commonly consumed ultra-processed foods include our snack foods, packet cereals, sugary beverages, and ready-to-eat meals. To share further light on this, I will just go on and invite our first speaker, Dr. ANUJA. Dr. ANUJA is a consultant pediatrician and lifestyle medicine physician. She's MBBS DNB Pediatrics. She's a consultant pediatrician with over 15 years of experience. And she works with Nanavati Max Super Specialty Hospital. And she's Doctor at Juvenile Diabetes Foundation. She's member of IAP, IMA, ISPAE, ISLM, and PAN. She specializes in preventive pediatrics, healthy lifestyle management for children and adolescents, and whole food plant-based diet consultations. She conducts workshops for new parents on newborn care, lactation, and mother's nutrition. And she leads parenting workshops and workshops for adolescents on managing puberty. She's passionate about creating whole food plant-based dishes and applying culinary medicines. And she's one of our board of director in PAN India Mumbai chapter. So welcome, ma'am. So the first question that we have for you is, what is the impact of regular high intake of ultra-processed foods on childhood obesity, metabolic syndrome, and how can clinicians integrate this knowledge into prevention strategies? Over to you, ma'am.
Yeah, thank you, Medha. Thank you, Pan, and thank you all the organizers, including Shruti and Bhavani. So when it comes to ultra-processed foods, we all know that they are hyper-palatable. They taste very good. They actually tweak our brain so that we forego our satiety signals. They also are calorie dense, but at the same time, they are nutrient poor. So because they are nutrient poor, calorie dense, and we easily forget our satiety signal. They are easy to overconsume. And what happens is because of excess calories but lack of nutrients, there is also hidden hunger. So ultra processed food overconsumption leads to obesity as well as hidden hunger, that is micronutrient deficiencies. And this, when it happens in childhood, lays the foundation for future poor health. So childhood obesity, as we all know, is so much on the rise right now because of these ultra processed foods and poor lifestyle habits. This is paving way for future metabolic syndrome, future type 2 diabetes, heart conditions, also autoimmune conditions. So a host of other lifestyle related conditions are going to be ingrained in the child because of the ultra processed food consumption. And there is a very strong correlation because of calorie density. So now what we can do as doctors to mitigate this is we have to educate our families. We have to educate the families to eat healthy, not just the child, but the entire family. So the food culture in the family changes. And we also have to take this beyond the families to societies. So at every clinic visit, it is important to reinforce what should not be eaten. Like we give them a list of ultra processed foods, we find out the times when these are consumed and we give healthy alternatives to the parents. And when this is reinforced at every visit, a small but definite change happens in the family. And when we take this to the society, we need to be strong advocates of serving healthy food in our school canteens, in our college canteens, and also at workplaces, and definitely in hospitals. So PAN is definitely doing a good job in that direction. But we as individual doctors should also do our bit, and together we can definitely impact a change.
Thank you, Doctor. I also have a second question for you, which is there any evidence supporting a connection between ultra processed food consumption and attention deficit and hyperactivity among children?
Surely. So ultra processed foods are concocted in a food factory or they are made in an industry. So they are not really foods, they are food like substances. So what is used in it is a lot of chemicals such as artificial flavors, artificial colors, preservatives, emulsifiers, leavening agents, gelling agents, and a host of other things. So all these chemicals are now known to have an impact on the gut microbiome to an extent. They also are connected with, like I told previously, tweaking the satiety center of the brain. There is a dopamine hit that happens. So when you have these foods, you feel a very good feeling and you tend to overeat these foods. And there is research connecting ultra processed food consumption in childhood to having more hyperactivity and attention deficit later in adolescents and adults. There are numerous studies conducted which confirm this correlation. So it is important to control the ultra processed food consumption in childhood itself. Also, in children who consume ultra processed foods in a high quantity, we see that these children are generally less attentive, they are more disruptive, they are irritable, they have a lot of mood changes. And the common reasons possibly are because of the sugar rush. These ultra processed foods are high in sugar, salt, saturated fats. So they give an immediate sugar boost. They give a dopamine hit. The child feels good, but there is also a following crash. And that leads the child to seek more and more ultra processed foods. And the mood also keeps changing. So there is a lot of irritability and hyperactivity even in childhood, but there is a correlation of early childhood consumption of ultra processed foods with hyperactivity later in life. So, all in all, we definitely need to do everything we can to avoid ultra processed foods and give healthier options to our kids, the parents, and the whole family.
Thank you, Dr. ANUJA. This was very insightful. And you mentioned about gut microbiome also. I have a question on this as well, but I will bring it little later in this discussion forum. So I will request if you could stay in the forum for a longer period of time. So the next question is for Dr. VARSHA. So Dr. VARSHA SHAH she is a practice pediatrician with special interest in adolescent medicines and lifestyle medicine. Dr. VARSHA SHAH is DCEd in pediatrics. She's MBBS, PG. She has done PG DLM in lifestyle medicine. She's a professor at SBKS Medical Institute and Research Center, Vadodara. She's a medical consultant at Sharon, an organization dedicated to disease reversal through lifestyle modification. She's a consultant at Prakriti Heal, a center promoting holistic health through lifestyle changes. She's passionate about integrating lifestyle medicine into undergraduate and postgraduate medical education as well. Her special interest is in lifestyle medicine, nutrition, disease reversal, and holistic wellness. She's experienced in conducting impactful health talks and lifestyle transformation programs for individuals and groups. And she's also a member of Indian Academy of Pediatrics, Indian Society of Lifestyle Medicines, and Physicians Association for Nutrition. So I really welcome you, ma'am, on this discussion forum and supporting us here. So, ma'am, the question for you is, how is picky eating behavior in children linked to consuming higher ultra-processed foods? And also, what are the nutritional and development consequences of picky eating behavior? Hello.
Hello. Yeah. Thank you, Medha, and thank you, Pan. Am I audible?
Yes, Dr. Varsha, you're audible.
Yeah. So, picky eaters, children often rely on ultra-processed foods due to their convenience and sensory appeal. You know, ultra-processed foods are engineered to be tasty, which plus they're nutritionally barren. Since they're nutritionally barren, their excess intake leads to compromised essential nutrients, and there is no dietary variety. Like in my practice, I come across 3 clinical situations where I see children hooked onto ultra-processed foods. One is when they are toddlers, not ultra-processed, but once children are weaned, you know, when they're given complementary feeding, most of the times when they're not taking that semi-solid or solid food, I have seen grandparents and parents giving lots of milk to such children. And such children are again become picky eaters. They are usually deficient in iron because excess consumption of milk leads to constipation and iron deficiency as well. Such children are also irritable and they become very picky eating behavior. So that is one clinical situation. Second, I see school-going children between say 5 to 8 years of age or 5 to 12 years of age who are picky eaters because they eat a lot of ultra-processed foods in form of packaged food and sugar-sweetened beverages. So, because these ultra-processed foods can low in satiety, you know, because they do not contain fiber, they do not satiate you. Like for example, even after dinner, while watching television, a child can finish an entire packet of chips. And sometimes when they are hungry, they will have a packet of chips, but they will not be satiated. Okay, so as Dr. Anuja said, all these lead to a dopamine hit because they have a sensory appeal. Okay, so this is also leading to a picky eating behavior, a lot of hyperactivity, attention deficit. And this leads to nutritional deficiencies in the form of multivitamin deficiencies, and they don't have fiber. So these children are constipated. Then there is deficiency of minerals like magnesium, iron, copper, and zinc, which are essential for immune health. So if you go to see, a lot of children who consume ultra-processed foods have frequent upper respiratory tract infections, frequent GI upset, and in the long term, they can also have increased susceptibility to infections and neurocognitive deficits. And they are having an increased risk for chronic disease earlier, you know, so they develop chronic disease, like we are seeing pre-diabetes in adolescents, early onset of hypertension, obesity, and metabolic syndrome, even in adolescents and teenagers. So that is about the consequences of picky eating behavior.
Dr. Varsha. So, Dr. Varsha, yogurt is always considered an excellent source of probiotics that supports immunity. And this is also loved by kids and everybody else as well. So the commercially packaged yogurt sometimes go under a double pasteurization process. So does this double pasteurization have effect on gut bacteria composition?
Yeah. So yogurt is a source of lactobacilli, which are the good bacteria in the gut. Having yogurt which is made at home is a good source of probiotics, no doubt about it. But when it undergoes double pasteurization, the live bacteria or the good bacteria are killed. So having that yogurt actually does not give those probiotics. Now I want to also make you understand what is prebiotics, what is probiotics, and what are postbiotics. Now, probiotics are the bacteria, the good bacteria which are present in your gut. Those good bacteria thrive on prebiotics. Now, what are prebiotics? Prebiotics are the source of food for those bacteria, which is the fiber. So, where do you get that fiber from? It's basically from whole foods like oligosaccharides or fructose oligosaccharides from fruits and vegetables, galacto-oligosaccharides from legumes and whole grains, nuts and seeds. So it's not only important just to have yogurt as a source of probiotics. For a balanced gut microbiome, you need to feed those probiotics or those bacteria with prebiotics, which is from whole food plant-based sources. And once your probiotics feed on those prebiotics, you produce what is called as postbiotics, or the short chain fatty acids and the butyrates, which have a gut strengthening, which prevent leaky gut and increase your immunity, and which enhance the gut microbiome. So for a good gut microbiome, you need not only probiotics, you need prebiotics as well. So what are the sources of probiotics? You have yogurt as one of the sources, and you have fermented food like idlis, dosas, your dhoklas, and nowadays people have those kimchi and tofu, tempeh, kombucha. All these are sources of probiotics. But probiotics alone will not help. You have to make those probiotics or those bacteria, the good bacteria, thrive. And for those good bacteria to thrive, you need prebiotics as well. Okay.
Thank you, Dr. Varsha. I think this was very good thoughts you have provided us from your own clinical experience. Next, I will request Dr. Kiran Vaswani for the next set of discussion. So Dr. Kiran Vaswani, she's MD Pediatrics from DCH. She has done PG diploma in Adolescent Pediatrics and diploma in counseling from TIS. She's a certified diplomat from American College of Lifestyle Medicine, and she's a certified lifestyle medicine physician. Dr. Vaswani is a consultant pediatric and adolescent health specialist working in Navi Mumbai, and she's the founder of Pulse Parents, Unconditional Love, Support, Encouragement, Empathy. Adolescent Health Ambassador for multiple IAA, which is Indian Academy of Adolescent Health Action Plans and Mission. She's an associate consultant for Freedom from Diabetes and faculty member for P4P, which is Parenting for Peace Project. She's a facilitator, basic life support, and advanced life support courses under IAP, which is in Indian Academy of Pediatrics. And she's a promoter of holistic health, wellness, and athleticism through digital platform, which is Health Timeout. Welcome, ma'am, on this discussion forum. So, ma'am, I want to start on this, that how thrifty gene contribute to the predisposition of Indians in metabolic disease and obesity.
Good evening, one and all. Clearly audible? Am I clearly audible?
Yes, ma'am.
Yes, ma'am. You are audible.
Thank you. Thank you. Good evening, one and all. And I really thank the organizers for giving me this opportunity to discuss something about which I'm very, very passionate. I really get affected when I see the children having these every day. So discussing on this from a platform like PAN, I'm really grateful to all of you. So what are thrifty genes? Okay, this thrifty gene was actually postulated based on two main observations. Like Indians, even when they have emigrated, have this vulnerability to develop metabolic diseases, obesity, and diabetes. And if you compare two individuals of similar BMI and physique, one an Indian and the other from another ethnic group, you will find that Indians have more fat compared to the other person and usually truncal obesity. So based on this, Dr. Neal in 1962 postulated that because of long generations of Indians facing famine, there has been a gene selection which they named as thrifty gene that helps to hold on to the fat. It saves fat, it doesn't let you. जैसे हम बैंक में फिक्स्ड डिपॉजिट्स बनाते हैं वैसा सेविंग 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 you keep saving. And this was okay in those times of famine and scarcity, but now it has become a maladaptive gene. Similar to this concept of thrifty genes, there is a thrifty phenotype, thin fat person. This is a different concept based on 1990s. It came as those who are born low birth weight, or those who have nutritional deficiencies or have been deprived of good nutrition in the early forming years, the body goes into a permanent metabolic change where the growing brain is developing at the cost of pancreas and muscles. So what happens? There is more fat, less lean mass, and in the end, even they are behaving like this thrifty genotype. So this is thrifty phenotype. So now let us understand another fact. There is an equation for a good glycemic control or glucose tolerance, so to say. On one hand is your metabolic capacity based on your pancreas ability to secrete insulin and the capacity of muscles to clear glucose. And on the other hand is your load, the metabolic load, which includes your body fat, sedentary habits, and the food that you are giving to the body. How high glycemic load or index is it? So based on this, two real implications that come out are, first, we as Indians, more so those who are low birth weight or have been deprived of nutrition, should be regularly charted on their growth charts so that they don't gain weight fast. Because it is a tendency in the families to feed these. Ye kamzor paida hua, he was born weak, so give him more. And they make him plump and short. Feed at this stage does not give him the stature or the muscle mass. So that vulnerability of what I said, the capacity versus metabolic load, that vulnerability of high fat in the body is there. So these people are more vulnerable to the ultra processed foods, which are almost playing to the tune of increasing the metabolic load, increasing the insulin resistance, and because there are no good muscles, there is no clearance of the metabolic load.
Thank you, Dr. Vaswani. Yeah. A second question, that how do ultra-processed food contribute to symptom severity of PCOS women, particularly with the weight management, the insulin resistance, and hormone imbalance?
Okay, this PCOS is a widely prevalent endocrinal disturbance in our times now. Around 4 to 20% of the women world over can be having it. Three important observations. First is they have compared the foods eaten by the PCOS women and other people. They have found that these women have more of high glycemic load, glycemic index foods, high animal protein, the ultra processed foods, much more than the minimally or moderately processed foods. And then they have also seen that while weight management in these people, swapping these ultra processed foods with whole foods has helped, while the other group had more of whole grains, fruits, vegetables, seeds and nuts, and legumes. Another important thing lacking in these PCOS women is vitamin D3 and folate. So these food patterns are very clearly different in the two groups. So they find that insulin resistance is also more, which is this high glycemic foods give them that insulin resistance, which is the key driver of PCOS. So this thing coupled with how it helps to prevent or manage once it is there. So we are comparing what foods they eat, then we are comparing how do they respond and how do we prevent also in young adolescents if you put them on that thing. Another important point that has been found in this group of women is this psychological understudied fact that these people are more prone for food addictions. So I think the ultra processed foods are the real best examples for food addictions because they have been designed and engineered to produce this addiction. So definitely these foods are contributing to the existence, to the severity, and then on swapping these foods, they are definitely contributing to the reversal also.
Thank you, Doctor. I think this very well explained the association in worsening the condition with the linkage of ultra-processed foods. Next is the emerging data indicate that consumption of high ultra-processed food is associated with increased risk of colorectal, breast, and other forms of cancers, possibly mediated by inflammatory pathways, exposure to carcinogenic additives, obesity-related mechanisms. So may I request if you could put some light on this topic as well?
Okay, this is a very big topic. I'll try to sort of simplify it in a few side headings. Like, first we will see what is it that this ultra processed food is composed of, and then how does it contribute. The first is, let us look at the composition of this food itself. It is lacking in nutritive elements like vitamins, minerals, and fiber, and is very high in sodium, salt, and sugars. Sorry, in salt, saturated fat, and sugars. So now, supposing you are taking a loan from the bank, how much do you give back and how much do you keep taking? So if you keep taking and taking, your loan increases and you are not repaying it anyways, then the recovery agents will come to your home. So similarly here, on one hand, you are lacking in protective factors. All the protective factors which are anti-inflammatory, antioxidants, and like protecting you, those elements are lacking in vitamins, minerals, and fiber, while you are taking only the wrong foods. So you have to pay with the price of just withdrawing and no protection at all. Now let us look at the second part. What happens during processing of these foods? These are subjected to such high temperatures for a prolonged period. You add such horrible additives to it, and the exposure to high temperature for prolonged period creates neocontaminants. So there are two ways of toxins being added. One is you already add, as you mentioned, and my previous speakers also mentioned, they add additives to improve the facts, that is the flavor, the attraction, then the color, texture, shelf life. To do all these things, they add additives, which are themselves very horrible industrial food, like industrial products. So they are the chemicals that harm. Then neocontaminants are produced, like these are such difficult words that you have to really train tongue twisters. Acrylamide is one of the most important carcinogen that is produced when you expose these food products to high temperatures. Another interesting process that these things go through is extrusion. What is extrusion? Keep it at high temperatures, but push them at high pressures through dyes so that you get good molds, the good shapes for textured proteins or for cereals, gummies, the candies, all those shapes that you get. Even that creates a lot of contaminants in the thing. Then third thing is when you package them. They are made from something which are not found in the kitchen. That is another important point. The starting products itself are highly refined, like starches, high corn fructose syrup, protein isolates, and saturated hydrogenated oils and things like that. Sorry, saturated fats and hydrogenated oils. So these starting products itself are wrong. Then while packaging, if you were to prepare something at home or a small cottage industry, it will be in papers or tins or some bottles or something like that. But here it comes in multi-layered plastics, aluminum, and pouches that are laminated. So this creates bisphenols A in the product, and this is another big carcinogen. Meat, when it is exposed to high temperatures for a prolonged period, creates heterocyclic amines, polycarb AHCs, hydrocarbons, or nitrosamines. These are highly carcinogenic. So ultra-processed foods, by virtue of their starting product, lacking their nutrients, things that happen during the processing and packaging, release very highly toxic chemicals and carcinogens. And the pathways are mainly, they again disturb your gut flora. Such chemicals cannot pamper your good bacteria. Then there is something like the chronic inflammation that comes in. Then there are aging glycation end products. All these things put together, then the meats are oxidized, the proteins in the meats are oxidized. All this put you at big risk of cancer. In the end, I would like to put in it in a lighter vein. I've just seen one cartoon some time back. It was really eye-opener. A person who's all weak and from malaria, he's recovering, he gives a big bottle of blood, a packet of blood, the packaged blood, and says, "Here, my friend mosquito, please have it and leave me alone." He said, "Nai, nai, I don't take any packaged food. I need my natural food." So the point is, even that mosquito knows what to take. And we as human beings who think we have highly evolved depend on the packaged foods. It's high time we started going back to our greens from the farmers and greens in the open spaces, and not on the screens and packets. Thank you once again for this opportunity.
Thank you so much, Dr. Vaswani. I think you have summed up it so nicely, and all the associations and the carcinogens and elements that could hinder with the mechanisms. Thank you, Doctor. Now, I think the topic led to discussion on gut microbiome and inflammation, all those angles. So I will start discussion on this. And for this, I would like to invite Dr. ANUJA first to talk about how does consumption of this high sugar and high salt products such as namkeens and biscuits alter the gut microbiota compositions, leading to gut dysbiosis, and what are the downstream effects on immune regulation and inflammation?
Yeah. So these ultra-processed foods, Medha, are rich in sugar, salt, saturated fat, right? And they lack fiber. They are processed, so they also have a whole lot of additives that Kiran Madam very nicely explained. And this cocktail together is really bad for our gut health because our gut contains a balance of good and bad bacteria, both. Now, like Dr. Varsha explained, the probiotics that we take from outside will only give us live bacteria. They are not going to colonize in our gut. They are just going to be thrown out. They will do their good job for whatever time they are there, but they are not going to establish colonies in our gut. So what is important is to give food to our healthy gut bacteria so that they are already there in our gut, but they multiply, they form, improve their colonies, they flourish and they thrive. And then they will make those postbiotics or the short chain fatty acids and other products which are beneficial for our health. So we need to give fiber. And what happens in ultra processed food consumption is they do not provide us enough fiber. So the gut bacteria which thrive on fiber are starved, they reduce in quantity, and automatically the harmful or the bad bacteria increase. And this is known as gut dysbiosis. Now, when the harmful bacteria increase, what products they form are going to cause a lot of inflammation. So the inner lining of the intestines contains cells which are tightly packed together, and the junctions are very tightly packed and closed. But because of these harmful bacteria, these junctions become loose and leaky. And this is what we call the leaky gut. So what happens is harmful substances, toxins are absorbed directly into the bloodstream, and these trigger an inflammatory reaction in the body, which leads to a generalized chronic inflammation. Now there is enough research now to connect this chronic inflammation to a lot of metabolic conditions like type 2 diabetes, obesity, even cancers, and also to conditions such as autoimmunity and allergic conditions. So when ultra-processed foods are consumed in excess, there is lack of fiber, lack of nutrients, the healthy gut bacteria suffer, the bad bacteria increase, and there is increased inflammation in the body. There is also immune dysregulation. So because these toxins are picked up as is from the gut, the body creates immunity against these toxins, and many times they mimic our body tissues and they also lead to autoimmunity. So overall, this creates a bad cascade, not just for the child, but later in adulthood as well. So it is important to kind of limit the use of ultra processed foods and give enough fiber through whole food, unprocessed and whole foods, mainly from plants such as your whole grains, legumes, green leafy vegetables, fruits, nuts, plant seeds. And why this is so important is because the gut is intimately connected to the brain. So there is a gut brain axis, there is a gut immune axis, there is a gut skin axis. So the entire good health starts in the gut. When the gut is upset, the mood is bad. So the gut brain axis also plays a very huge role, and the vagus nerve has a huge contribution here. So we need to keep our gut bacteria healthy so that our cognition is good, our mood is good, and there is enough studies to support this concept that the gut causes changes in the mood and cognition. Also, skin conditions deteriorate when the gut is unhealthy, and also immune conditions. So we see a lot of kids falling sick frequently, and even adults coming with a lot of autoimmune conditions and inflammation generally leading to all the lifestyle conditions. And the core reason is the poor diet.
Thank you so much, Dr. ANUJA. I think follow up to this question, may I request Dr. Kiran Kulkarni to join us for his views on plant-based diet. So Dr. Kiran Kulkarni is a senior consultant ophthalmologist. He's MBBS, passed out in 1984 from TN Medical College, Mumbai, and has done MS in Ophtha in 1988 from TN Medical College, Mumbai, and then DNB in Ophtha in 1989 from National Board of Examinations, New Delhi. He's a teaching faculty, lecturer, and associate professor in TN Medical College, Mumbai from 1988 to 1994, and was a consultant ophthalmologist at Armed Forces Hospital, Muscat, Sultanate of Amin from 1994 and 1999. He was a consultant ophthalmologist at Netra Kiran Eye Center, Mahim, Mumbai from 1999 till present. And he's a visiting ophthalmologist at CBI Corporate Center, Mumbai from 1999 to present. He's on a plant-based diet since 2020 and following a whole food plant-based diet for last 9 to 10 months. And he's an advisor to Pan India Mumbai chapter. So welcome, Doctor. Welcome on this discussion forum. And we would like, yes, Doctor. So we would like you to shed some light on that would plant-based diet and probiotic consumption support healthy gut microbial growth?
Yeah. So first of all, big thanks to PAN and all the organizers of this discussion forum. Yes, definitely, plant-based diets and probiotics can support a healthy gut microbiome. We need to first understand what are pre, pro, and postbiotics. I know Dr. VARSHA has very beautifully explained, elaborated this, but I'm going to repeat it as one has to hear it, not 2, 3, maybe 4, 5 times to actually understand it. And this I'm talking from my own personal experience, by the way. So what are prebiotics? Prebiotics are nothing but non-digestible food fibers, for example, resistant starch, oligosaccharides, inulin, etc., which feed the good bacteria in the gut, helping them grow and flourish. What are the common sources? Vegetables, fruits, chicory roots, garlic, onions, bananas, whole grains, oats. So these are all prebiotics. And what are probiotics? Probiotics are live microorganisms like lactobacillus, bifidobacterium, which we consume in our foods. They add beneficial strains to the gut microbiome, supporting digestion and immunity. And the common sources are yogurt, kefir, kombucha, kimchi, sauerkraut, and supplements which are available in the form of tablets. Postbiotics, again, are metabolic byproducts from probiotic activity, which are short-chain fatty acids, peptides, and vitamins. They can have, mind you, they can have direct health benefits like anti-inflammatory or immune modulating benefits without needing live bacteria. And the examples are butyrates, acetates, propionates. In short, in one sentence, if you have to put it, prebiotics nourish the probiotics and probiotics ferment the prebiotics, that is the fibers, producing postbiotics. And postbiotics then support the gut health, nutrient absorption, and even mood regulation. As Dr. ANUJA has already said, the gut-brain axis. Here, there's a point to be made that animal foods, including dairy and dairy products, have zero fiber. And as we all know, fiber has become a very, very important macronutrient. We all know about proteins, fats, and carbs. But along with it, fiber is now the main macronutrient in which most of the population is lacking. Plant-based diets are very high in dietary fiber, polyphenols, and other bioactive compounds that act as prebiotics. So this promotes greater microbial diversity and balance, which are key to maintaining gut health. Probiotics, which are live beneficial bacteria consumed through supplements or fermented foods, can directly introduce helpful microbiomes to the gut ecosystem. Together, plant-based diets and the probiotics help restore and maintain a good gut microbial balance, increase the good bacteria, reduce the bad bacteria, which enhances immune function, reduces inflammation, and improves metabolic health. So incorporating both into daily eating habits can be a good practical strategy for sustaining a resilient and healthy gut microbiome. So one would ask, what is the daily fiber requirement for an average adult person? So I would say anything above 30 grams per day, maybe around 35 to 40 grams also for an adult male, and around 25 to 30 grams for an adult female should be a good fiber intake. Yeah, I think that sums the healthy gut microbiome. Dr. Medha.
Thank you so much, Dr. Kiran Kulkarni, and wonderfully explaining the benefits of whole food plant-based diets. Next, I want to speak about food labels, because food labels are very prime in understanding the whole the foods, the packaged foods. Are they nutritionally superior or not superior, and how consumer can become more aware and educated about them. So I would like to ask one question from Dr. VARSHA, which is that we have seen in countries like Japan, they have simple color code symbols on food labels, which is very simple on the front of the pack only, which help consumer pick a healthier product. So why in India we're not able to see that front of pack labeling is mandatory and not that
Yeah. Hello, Medha. Am I audible?
in this segment?
Yes, ma'am, you are audible.
Thank you. Now, there's a lot of color coding on packaged foods across the world. Like Japan has color coding, Brazil has black box warnings, Australia has banned those colorful toys given as freebies with, chocolates and desserts and all. Even UK has a food labeling, where you have a green label, orange and a red label, where green is good to go, orange is occasional, and red is not very good as a food. Now, in India, when you come to this, why we don't have, because there's a lot of industry resistance. Food and beverage companies have expressed that concerns that, their cost will go up, the sales will get impacted. And they argue that these additional regulatory burden may increase, hamper their sales and lead to hesitation in. That's why they're very hesitant to quick adoption of these. Secondly, the FSSAI, the Food Safety, and the FSSAI is actually working on an evidence-based labeling system, which is known as the Indian Nutrition Rating. But the final approval and implementation require extensive deliberation. They have got some 14,000 views, and they're still working on it. And there is a lack of clear, uniform visual labels in India, because again, the dynamics, the Indian government and FSSAI are balancing public health and industry dynamics, along with, of course, there are political pressures and industrial pressures. Now, but does that mean that there is no hope? Of course not. Like, for example, if you remember the controversy that Food Farmer created, there's this Mr. Himmat Singh Revansikar, who pointed out the high sugar content in, food drinks, which are labeled as health drinks. And the government and the, pediatricians and nutritionists supported him. And that particular company had to reduce the sugar content. Now, what is important is we have to educate our children into nutrition labeling. Packet uthao or ghumao and padho packet. We have to, the Indian Academy of Pediatrics has started the SSS program, the Sankalp Sampurna Swasthya, where we actually teach how to read nutrition labels. So that is a very important step, which is, before even the front of package labeling, whether it comes, we have to empower our children to make healthier choices, So that is something that as pediatricians, we can train the parents and teachers. Secondly, the industry maluses, there are ways to cut corners. Like, for example, I'll share with you, Diet Coke in UK, has got 4 green lights. You know why? 1 green light because it is 0 sugar. 2nd green light because 0 salt. 3rd green light because 0 fat. And 4th green light because 0 saturated fat. Does that mean that Diet Coke is a good thing? And teenagers and adolescents pick up Diet Coke thinking that they will not put on weight. But what does it actually contain? Here the industry has cut corners, because if, it would have got the 5th green light had it mentioned that there was some fiber in it. But actually, scientifically speaking, when you drink Diet Coke, what happens is there is aspartame and acesulfame K, which is a 0-calorie sweetener, which is actually 200 times sweeter than sugar. So when you drink it, it actually stimulates the taste buds on your tongue and sends signals to your brain that something sweet is coming. The brain sends signals to your pancreas to release insulin. But when you drink it, there's no calories, there are 0 calories. So the insulin that is released reduces your blood sugar. So actually, drinking Diet Coke does not help. It increases your appetite. But Diet Coke, 0 sugar, good for weight loss. That's the marketing that is done. So that's how industry actually cuts corners. Of course, but what we have to educate our children and our parents is how to read those food labels. What are the chemicals which are present in those which are not present in our kitchen? How they are high in sodium and SOFAs. SOFAs is one of the acronym. Salt, oil, refined flour, additives, and sugar. So these are the 5 things that we also teach our children to identify when they, read nutrition labels. And of course, with more awareness, I think this is going to come very soon. Thank you.
Thank you so much, Dr. Varsha. Next, we have Dr. Manali Pavan Rao. She's a consultant family physician and lifestyle expert. She is MBBS from FID UK, general practitioner and diabetologist for over 9 years of experience, strong advocate of lifestyle modification for holistic well-being. She's practicing family physician at Fortis Hospital, Mulund. She's one of the board of directors at Pan India Mumbai chapter. She's a former medical officer at Sian Hospital, Nightingales and MyCare. She's a consultant at GOQII Technologies and Luke Coutinho's Holistic Healing Services. She's a former associate medical data review manager at IQVIA India RDS. She's a private practice at Lions Club Polyclinic. She has expertise in lifestyle medicine, diabetes, thyroid disorders, PCOD, hypertension, autoimmune conditions, cancer support, weight management, and geriatric care. She is a trained in yoga and a professional Bharatanatyam dancer and founder of Nitya Vidya Nilaya, Mumbai. She is an avid reader and painter and writer. Welcome, Dr. Manali, on this platform. So quickly going to the question, that how can clinicians advocate for policies to reduce ultra-processed food consumption at the population level, and what role does clinical practice play in this effort?
First of all, thank you, Pan, and thank you, whole team, for arranging this wonderful discussion forum. So much to learn. So, to answer your question, Medha, as clinicians, I think we play a very crucial role, because when our patients come to us, they come to us with a trust, and the trend from what I have observed has certainly changed, wherein the patients are not just looking for medicines, they are looking for much more. They want something more wherein we can guide them, even in terms of their lifestyle. Yeah. So why are these, ultra processed foods consumed at large? Because, from what I have seen, it is mainly because of their colorful packaging, their loud marketing. It is obviously attractive, and, people are stress eating, and it is easy, ek packet le lo, kha lo. There's nothing that you have to use your brain over there. You don't have to sit and cook. You don't have to think of anything. You just have to eat. You just have to munch. And obviously it is tasty and it's palatable, and many a times that's what we opt for. But this is exactly where we play a role, wherein we can actually support public health policies like, taxing sugary drinks, limiting the marketing of these ultra processed food, especially to children and, young adults, because that exactly is where the consumption is very, very high. And as Dr. Anuja rightly said, childhood obesity is on the rise like, nothing else. And India is already the diabetes capital of the world. So this is all of this. The root cause definitely is the UPFs. Okay. So one more thing that we can actually do in this case is, encourage front of package, that is FOP labeling, wherein we can promote the key, the label, the nutrition, etc., the label that is behind. Most of them don't even turn around and check ki kya khareed rahe hain. So instead of that, if there is a package in the front with the details of what is there in what is the content of that particular product, and wherein there is a clear warning, like how we put danger signs, when there is a clear warning about high sugar, salt, and all the unhealthy fats that are there in these UPFs, I think that will definitely help a patient or a consumer in general to make healthier choices, and definitely restriction on aggressive marketing of these UPFs is definitely very, very important. Also, participating in community health activities wherein we can educate our community, wherein we can give nutrition education not only to doctors but also to people in general. Go to schools, create more awareness, conduct camps, educate educate the parents, teachers, and also the children. Okay, so this is very, very important. And another factor, what I feel is equally important, is screening at our level, wherein a physician, when we are doing our history taking, make it a little more elaborate. Try to get into it deeply. Try to ask your patient, and during your consultations, ask them about their UPF consumption. Suppose you have a lipid profile wherein the triglycerides are 300. Don't just prescribe a statin. Try to ask and see what exactly the patient is eating. That is exactly where you need to change. You can go on increasing the medication. आज 10 mg दे दिया, कल को 20 दे दिया, परसों 40 दे दिया. This will just go on increasing. But if you're not addressing the root cause here, then I think we are at loss. We are, in fact, harming the patient more than helping. And in this way, I think, by combining our clinical practice, the care, and also community outreach, wherein a policy support, drive wherein we can help them to, opt for a healthier behavior in general, wherein we can push for these food regulations. Okay, all these things together will build a momentum. It will help us to, create a good systemic food environmental reform.
Doctor, would you like to share something on what knowledge would you like to give on reading the labels?
Okay, I think VARSHA ma'am has already told about this, so very well explained. Reading even Dr. Kiran has told a lot about what all ingredients are there in the labels. So as clinicians, what we can tell, the first thing that I think we can do is teach our own family. Because that is how it spreads. Word of mouth is very, very powerful. For example, if we tell our child, ki, Baba, I'm going to give you healthy food. This is what is there in this. So tomorrow when they go to school with that particular tiffin, when people around them, initially they will definitely say, Arey yaar, kya hai, tu sirf healthy lata hai. But there will be some point wherein it will click and ki, okay, there is a reason why this child is eating healthy. And the more appreciation that child gets, the other children start mimicking. And that is exactly where we win. So teaching our family, telling them, how to identify the labels. Simplest things that we can tell is, check for sugars, check for unhealthy fats, check for high levels of sodium, added preservatives, emulsifiers, and other simple way of telling them is, pehla jo 5 se 6 ingredients hai, the first 5 to 6 ingredients are the ones which make the 80% to 90% of that particular product. And rest of the things, even if they are so-called healthy, maybe just 1 to 2% in that particular product. So we have to emphasize on reading the ingredient list, the serving sizes, and also the percentage daily values. Okay, this will definitely help the patient to make informed choices ki chalo ye mere liye sahi hai ki nahi hai. Like ma'am already said, partially hydrogenated oils are there, high fructose corn syrup, MSG, all these are going to impact their health. We can give them some guidance ki what exactly happens when you do. Abhi diabetics come to me and say ki ma'am, I'm not having sugar, but I'm having good, I'm having jaggery. Or some of them come and say, I'm taking that, what is that called? The artificial sweetener. Is that okay? No, that is as bad, probably worse. The sugar pills that they take, it is even worse. So what we need to tell them ki no, you should avoid it completely. Opt for natural sweets. You have dates, you have fruits. So let that be your go-to snack. And I think the biggest place where everyone is faltering is snacking. So that is something we need to definitely guide. When you're hungry at that 4 p.m., 5 p.m., don't go and take a packet of chips. Instead, go and take a handful of makhanas, handful of roasted chanas. You can take a fruit. This is how we try to teach them. And that's exactly where, thoda sa piche bhi dekh lo, ingredients mein kya likha hai, and what actually falls under the RDA, that is the recommended daily allowance of that particular product. Okay, and I think, see, like Kiran ma'am told so beautifully, ki every animal also knows what to eat and how much to eat, except for us who are so evolved, technically evolved. So I think this is how we can try to, help our community, right? Yeah.
Thank you so much, Dr. Manali. So we are actually, thanks to all the speaker actually for joining today and sharing some insights basically on this topic of ultra processed foods and human health. And we are very, like, it's clear that the whole family needs to be educated on the harmful effects what ultra processed food compromise of, and because it's not just linked to one age group, it's basically a cycle. If the consumption in childhood has effects on adolescence and later years, and we being Indians are already at a risk of metabolic disorders, and we're aggravating ourselves by the consumption of ultra processed food. So there's a need for clean label products. They need to add more education on how to read the labels, and more enforcement and education to the whole family on healthy eating. So I thanks all the speaker who could come today and be part of this discussion and share your valuable insights this evening. May I request if everybody can stay on hold here so that we can have a group picture also. Share the gallery view so that everybody gets captured over here. And may I request others also to please switch on their videos if they can, so that we can take one group picture.
I love to give a congratulations, and plus it was very, very, very much informative subject discussion, and it's a very beautiful explanation. All the best for everyone.
Much, Dr. Gupta. Thank you.
Thank you, everyone. I've taken the picture.
Thank you so much, Dr. Jyoti. And good night, everyone. And enjoy the Sunday.
Yeah.
Thank
you,
you.
Dr. Shruti,
Thank
Medha,
you. Good
and
night.
the whole PAN team.
Thank you, Shruti. Thank you, Medha.
Good night.
And thank you, everyone.
Yeah, looking forward for more such discussions.
Yes, sir.
Yes.
Thanks everybody, sir. Thank you so much.
Thank you.
Good night. Good night.
Good night.
Mira,
Good
you
night,
did
madam.
not switch on your camera.
Sorry?
I just realized my camera was off. I didn't realize it.
Oh, Medha.
I was presenting, so I couldn't see any screen, so I didn't realize it.
It's okay. Let me take this now. 1 second. I'll crop it like and put you there. 1 second. Don't leave.
Use AI.
Yeah, I'll do. Thank you.
Okay. Bye. Good night.
Bye, everyone.